What do you do when you've tried everything to relieve a pinched nerve in your neck, but the arm pain, the numbness, and tingling just won't go away? You'll get that answer in this video. And no, it's not about stretching harder or doing more exercise reps. After helping thousands of patients over the past 15 years fix pinched nerves that exercises alone couldn't touch, I discovered there are 3 missing steps that make all the difference. In this video, I'll walk you through the exact 3-step process, the process that finally ends the pain, restores strength, and prevents the problem from coming back. By the end, you'll know exactly what to do and which type of doctor can fix this for good. But make sure you stay until the end, because missing even one of these steps could be the reason your pinched nerve and arm pain never goes away. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, and pinched nerves and chronic spinal conditions without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Let's start with step number 1, pinpointing the actual cause of a pinched nerve in your neck. Now, this might seem simple, but stay with me, because this is where most people, and even some doctors, even get it wrong. You might have been told that you have a disc bulge or a protrusion in your neck after an MRI. Maybe your doctor said that's why your arm goes numb or tingles. Or maybe your x-ray showed degenerative arthritis, and they told you that's what's causing the pinched nerve. And sure, that might be partially true, but here's what almost no one explains. What caused the disc bulge or arthritis in the first place? Because that's the real root of the problem. The most common reason for a disc bulge in your neck isn't just bad luck or getting older. It's actually due to something called abnormal spinal alignment, or in simpler terms, a spinal misalignment. That means one or more of the bones in your neck aren't lined up in the way they should be. Sometimes it's one bone that's out of position. Sometimes it's several in a row. Other times, the natural curve in your neck reverses. That's called a loss of cervical lordosis, or you develop forward head posture from years of looking down at your phone or at your computer. Over time, those bad postural positions put constant pressure on the discs and joints in the neck, and that pressure causes discs to wear down, bulge, or even herniate. It also speeds up arthritis, and that's the true underlying cause of what pinched nerves in the neck. If you don't correct that, the pain will always come back no matter how many exercises you do. And that's exactly what we do in our clinic. We start by correcting these underlying spinal problems. And in a moment, I'll show you how we do that, so you get lasting relief from the pinched nerve and not just temporary fixes. Step number 2 is where we start making real progress. It's all about specific spinal corrections using gentle, targeted chiropractic adjustments. Now, here's why this matters. Your spine is made up of 24 vertebrae stacked on top of each other with a disc in between each one. Think of it like this: a vertebrae above, a disc in the middle, and another vertebrae below. Together, that makes a functional spinal unit, or what we call a motion segment. For your spine to stay healthy, that motion segment needs to be both aligned and moving properly. But when it's not, everything around it starts to break down. One of the first things that gets affected is the disc. The disc is strong, but it's not indestructible. When the spine is misaligned, it changes how weight and pressure are distributed. Suddenly, the weight of your head is shifted to one side more than the other, and over time, that uneven load causes small tears in the outer layers of the disc, called annular tears, and then the disc begins to bulge out. You might not feel it right away. This happens slowly over years, but eventually that bulged disc at C5-6 or C6-7 can start pressing on a nerve, and that's how a spinal misalignment leads to a disc bulge, which then leads to a pinched nerve. Another way this can happen is through a spinal degeneration. When these same misalignments stay uncorrected, they cause wear and tear on the joints in your neck. Over time, your body responds by forming bone spurs. And when those bone spurs grow into the small openings where the spinal nerves exit, called the foramina, they can also compress a nerve and cause a pinched nerve in your neck. Now, sometimes it's not just one or the other. It's a combination of both disc bulges and degenerative spurs, all triggered by the same key factors that are often completely overlooked: spinal misalignment. So, my job as a chiropractor is to find those misalignments using specific methods and precise x-rays. Once we locate them, we start correcting them with gentle, specific chiropractic adjustments. Now, what do these adjustments actually do? They restore alignment and motion to those individual spinal segments. And when the spine moves back the way it was designed to, several powerful things happen. First, there's less irritation on the discs and ligaments in your neck, which relieves a lot of local pain that comes with misalignments and pinched nerves. Second, those adjustments help your spine move the way it's supposed to, which takes that abnormal pressure off the discs and finally gives them a chance to heal. And third, they open up space around that pinched nerve, which relieves pressure and helps reduce the tingling and numbness in your arms. Now, many patients, just by introducing chiropractic adjustments, do incredibly well. For a lot of them, that's enough just to fix the pinched nerve and eliminate the pain. However, what if you get relief but not complete relief? What if the arm pain or tingling is still hanging around? That's where we move to step number 3. And let me tell you, this next step can make all the difference in permanently healing that pinched nerve. It's the missing piece that most people never get to experience, and it's about to change everything for you. The missing piece is cervical decompression. You've probably heard of spinal decompression for the lower back. That's the lumbar spine. But did you know that you can do the same thing for your neck? That's right, cervical decompression is possible and has been an absolute game changer for our patients. Let me explain how it works. Step number 3 is non-surgical spinal decompression. Now, what exactly is that? Non-surgical spinal decompression involves gently stretching the spine in a very controlled way to create more space between the vertebrae. The goal is to reduce pressure inside the disc and allow it to heal naturally. You can imagine that where the disc bulge or protrusion, that tough outer layer of the disc, is pressing right up against that delicate nerve, and that nerve is carrying important signals from your brain to the rest of your body, and in this case, down your arm, hands, and even your fingers. Now, imagine you had a process that gently pulled that disc material back towards the center, taking the pressure off of the nerve and letting it finally breathe again. That's exactly what spinal decompression is designed to do. It can be done for the lower back, but can also be done for the neck, and that's where cervical decompression comes in. Let's focus on the neck, the cervical spine. Cervical decompression works by creating a small amount of negative pressure inside the disc. Think of it like a vacuum effect that pulls the bulging or herniated part of the disc back towards its normal position. This not only reduces the compression on the nerve, but it also helps draws in oxygen and nutrients, which are essential for disc healing. In our clinic, we use a specialized equipment called the Back on Track with an add-on cervical decompression unit known as the cervical traction unit. Here's how it works. You sit or you lie back comfortably while the machine gently moves your neck through a controlled decompression cycle. It's slow, it's rhythmic, and it's incredibly relaxing. There's no twisting or quick movements. Most patients actually say it feels like a deep, gentle stretch that takes the pressure off instantly. This treatment dramatically reduces pressure on the pinched nerves, helps restore spacing between the vertebrae, and accelerates the healing process inside the disc. Now, when you combine this with the corrective spinal adjustments from step 2, you can see how powerful the results can be. You're not just masking the pain anymore. You're fixing the root cause of the problem, giving the nerve the space it needs to heal and restoring proper alignment so it doesn't come back. That's how patients in our clinic go from chronic neck pain and arm pain to living normally again. And that's what makes this 3-step approach so effective, especially when the usual pinched nerve exercises alone haven't worked for you. Now, don't get me wrong, I do recommend exercises to my patients. In fact, I have a full video that walks you through the best exercises you can do at home to relieve a pinched nerve in your neck. But as you've seen today, sometimes you need to go deeper. You need a professional evaluation and targeted treatment to correct the real underlying cause, not just manage the symptoms. So if you've tried the exercises and the pain keeps coming back, this 3-step approach could be the missing link for you. Don't lose hope and don't give up. You can get better. Be sure to get checked by a chiropractor who's trained in cervical decompression. If you need help finding one, let me know in the comments below, and I'll do my best to point you in the right direction. And if you found value in this video, like and share it, because you never know who else is struggling with the same neck and arm pain and needs to hear this information. Remember to subscribe now if you want more proven tips to help you feel better, move better, and stay pain-free. And the next video you should watch is this one. It's all about the best way to sleep with a pinched nerve in your neck so you can finally get relief from that arm pain at night. Go watch this video next.